think we have time for about one or two more last questions, if we can. Okay.
I wish to inquire for regarding mental illness, especially the younger population, is more prevalent. More and more people, proportion of younger people are having mental illness. I noticed that, like Dr. Tambyah said, we use Panadol to pacify the comfort, to mitigate the effects of mental illness and not tackling the underlying cause of mental illness, of more and more younger people especially having mental illness. I noticed that, my personal point of view, all the MPs, not a single MP, tackled the underlying issue, all provided Panadol. Is it the system, our culture, middle generation and the older generation, we cultivated the culture and the upbringing that brought the younger people to this state. We are the ones that caused this. So how are we going to tackle the underlying issue? Like I said, not a single MP. I think 40 MPs talked about mental illness, none tackle the underlying issue. All talk about Panadol. So I would ask the present MPs and those academics, how are we going to tackle the underlying issue and reverse the trend of having more and more people having mental illness?
Just one way to maybe tackle and reframe the question is also, when we're looking at issues, single issues like mental health, even climate change, and just looking at very broadly the tackling of issues and diversity of voices in the Parliament. I wonder if maybe Dr. Tambyah, if you want to address this, how do we make sure that happens in Parliament decades down the road?
I hear what you're saying, but and I think in the context of today's discussion, I agree entirely with what Wyman has said. Is that you really need different voices. You need voices of people who have different backgrounds, who have different environments, who don't all come through the scholar senior civil service. And then when you have these different voices, you are going to, because you're representing different constituencies, you're representing people who have family members with mental illness, who have mental illness themselves, and many other issues. So basically the whole point is diversity. And like I mentioned earlier on when I started my talk, we tend to view polarization as a very bad thing. But on the other hand, uniformity is also a very bad thing. And so it's got to be a diversity of views. There's no one solution to that, but we have to find the solution together. And the only way to do it is to look at it from different lenses.
Even the psychiatric NCMP also did not address the underlying issue.
Let's take that conversation offline, and I think with that, I really wanted to thank all the panelists, the speakers, Professor Walter Woon and Inderjit, who we have with us online and who have took time to join us despite being quite busy with your schedule.